Alright, hi guys, it's Dr. Emer. We're getting ready for doing a Cellfina procedure today. We have so many women who are very athletic and fit, like my patient here today, who also have a little bit of looseness that starts to develop with age, and then they get some cellulite. So our goal today for her is to try and give her some improvement in the cellulite areas and that's why we're under a special light that's really going to show us the cellulite more, and we're marking these areas, the dimples and some of the waves, to try and release the bands underneath the skin that will, you spread just a little bit, yeah, right there. We'll release the bands a little bit to help give her improvement in the overall look of the thighs, which have some waves on the thigh here in the posterior thigh, and some dimpling that she has, turn a little 45 degree, and some dimpling that she has on the buttock itself. Cellfina is the only FDA approved device for cellulite that's long lasting, but it really needs to be for the candidates where it's been shown to work. And the majority of these waves do a little bit, they don't do as good as the dimples. So her buttock will actually do a little bit better than her thighs, but she should be able to get a really nice outcome. And you can see we're really highlighting these based on the certain lighting that we have. Go ahead and turn again. Turn one more right there, perfect.
Can I ask a question?
Yeah?
So the difference between waves and dimples, what's the difference in the skin?
So that's a good question. So dimples have connective tissue underneath them that are really pulling them down and form more of a circle, whereas the waves are more of looseness in the skin that develops and is not as much due to the bands underneath. That's why the dimples respond better than the waves do. And some women actually need to have sculpture injections or some sort of volume, whether it's fat grafting. Because you see here, if I just lift the skin up, look, all the cellulite disappears. Because in this area, it's due to looseness in the tissue. Whereas here, it doesn't matter if you really pull up or not. Turn a little bit again. It's more due to the actual genetic tissue that's there. So we've pretty much been able to identify the ones that are going to respond really well. With her skin type, we want to be very cautious about how we do this because we don't want to leave marks on her. There's this little needle that goes in. But overall, I think this is going to be a good improvement. Turn again. Let me just take
What do the different marks mean?
Turn again. This is the way in which we do the treatment. So that's for me to know, and then for you guys to just see the result. Turn a little bit. So that's what we're gonna do. I'm gonna take a picture of that and I'm gonna compare it to her initial. Turn this way. Ooh. And then turn the other way, 45. Perfect. Hold on. Okay, so we've done the marking process and then you guys can see the actual treatment very shortly.